morning, everyone. Welcome back to the program as we welcome to the desk our good friend, Dr. Eugene Cherny from Heartland Plastic Surgery.
Morning, guys. Great to see you.
Morning.
So are you a busy guy this time of year, or what's the deal?
Crazy busy. Everybody wants to look good for the summer.
There you go.
Everybody's getting ready for weddings, and although it's all supposed to be about the bride, nobody does not want to look fantastic when they go. And reunions, oh my God, you really got to get spiffed up for the reunions.
Yeah.
All right, so
Oh boy.
now, typically timeline-wise, what is the turnaround from, say, somebody comes in and says, I need to get rid of this, or I need to get rid of something over here. What's the turnaround from when you perform your surgery on them to when they can be seen in public again?
Well, if we're talking about liposuction here, you're out in public, like the next day or the day after, unless it's like, some really large volume procedure, and then it's like a few days.
So that it's not that much of a time span. Okay.
No,
good.
no, you get a compression suit on where you've been liposuction so it doesn't swell, and you go back to work like the next day.
As I say, let's talk about this fun thing that I've gotten since I've gotten older and don't really.
Those are just massive tries at rest.
Oh, that's what it is. Yeah, let me flex.
Massive
No, it's still there.
triceps at rest.
It's
Yes.
still there. It's still there even when I flex. So you got a bit of an issue. Maybe not something I'm concerned about as far as.
like this.
Oh, okay.
Yeah, you're right.
Yeah, I know it's still
I
there.
gotta look at that mole.
Oh, no.
We got other troubles now.
I've had that since birth, Doc, so I keep an eye on it.
It's for instance, since birth, it can become malignant.
I know. The doctors always tell me, so I keep a good eye
We are
on it.
making an
This is
appointment.
my identification, so if someone does something to me, I have 3 of these on my body all on the same side. So that's the only way you can identify me.
You
So
better have him look at that.
I'm hanging on to it as long as I can, if, for some reason. I don't know why. But
It does become it becomes a part of you and a part of your identity.
it does. If I've had it since birth,
absolutely.
it's one of those things. I'm used to seeing it. So, but I am keeping an eye on it,
Yeah.
courtesy of some doctors' suggestions. But if I'm looking at doing this because I'm like, man, I wish I just didn't have the ability to fly anymore. What would that process be looking like?
People love getting their arms done. It's because of tank tops and fashions now.
Right.
This is something when I was a young resident, we hardly did that operation at all. And now we do like a lot of them every month and it's probably because of fashion and people look at each other's arms. So if it has the same rules of liposuction everywhere. If the skin tone is adequate, you can liposuction it, and it's a great place to liposuction. And that has very little downtime, and you're looking great very quickly.
How much are you removing from someone's arm like that?
You have to remove enough that the skin is thinned down to the thickness it should be. You remove, if your fat is this thick, you bring it down to this far.
Okay.
And it's done with the gradual sculpting process. And then after the swelling goes down, it's dramatically smaller.
Okay.
So yeah, and so that's all if the skin tone is good. Now if the skin tone isn't good, there's a brachioplasty, we call it, where you actually remove the excess skin, and there is a scar that goes from here to here. Now that we see in a lot of people, like say, that have lost like a lot of weight, 50 pounds
sure.
or more.
Right.
And then with major weight loss, that's a whole different game. You got to do big excisions. A lot of times we'll excise a lot of loose skin under here and lift the breast with it and things like that.
So that's going to be more of a major.
That would be
surgery.
more major, and there you're talking about a recovery of like a week to 3 weeks.
Okay.
Okay.
A little bit more intensive.
A little more intense.
How soon would you be able to wear a tank top if you're wearing a compression suit or area for the arm? Like, how soon would you be able to throw on the swimsuit or a tank top so
I'd
people
say-
couldn't tell?
I would say after a week you can take it off to go out or to go swimming.
Okay.
And then just wear it at night.
So it's really just the swelling, not bruising or anything like that?
Got a little bruising, but not bad.
Not bad. Okay.
not bad.
Gotcha. So the recovery is not as bad as people think, I think, is what we're learning this morning.
Liposuction is something that was discovered in the 1970s, and it's been studied and refined, and it's something that's tried and true, and that really, really works if the guy knows what he's doing, and number one, and if the patient is the right choice for it.
So how do you get the material out of there? Do you zap it with some kind of
Lasers?
Yeah, or sound or something, and then liquefy it, or how do you remove it?
Now this is the new thing with traditional liposuction. You anesthetize the area and you make a little tiny pinhole incision, and you use a tube to kind of honeycomb the fat to gradually shrink it down. So it's actually being removed from your body and going down the sink. It is gone. And that's why it's so definitive, and that's why you know that it's going to work and get the job done. Now there are new, minimally invasive things, and this is coming up. I'm going to talk about it on next time I'm on Great Day.
Okay.
So many patients want something that's non-invasive. We are getting a technology that you can just have over your lunch hour, and it will shrink up to 20% of your fat under your skin. without any incision at all, and you can have it over your lunch hour. It takes about 2 months to see the full effect, or 3. But I'll roll out that new technology in a couple weeks.
So this would be something more immediate but invasive, but you have something that's not invasive, but you
Yes.
see over a period of time.
It's not as powerful. Now it's only going to be good for like smaller like bulges here and there on people that are slimmer.
What part of the body are we talking?
Oh, you can do chin, you can do arms, love handles, thighs, the whole shebang, the whole Megillah, everything.
Now, doing a process like this, I imagine you also
Yes.
encourage people to be active and stay on a strict diet, because what are the chances of that fat coming right back?
Well, the fat is gone. Now you can regain the weight and it will go elsewhere.
Okay.
But yeah, it's really important. Yeah, it's really important to not gain weight after you've had the surgery, because I've had this happen before where, you know, I work my heart out to get as much fat out as I can, and the patient goes and like pigs out and comes back, has gained 20 pounds, and says, "Dr. Cherny, your surgery didn't work." And I'm looking at them and I'm doing. And
So
I'm
these
saying,
are all
oh my God.
These are all new fat
Oh,
cells.
wow. Can
No, you
my
do not-
stomach
You're
look like
done.
that?
You're done with
No,
the fat cells.
you only build fat cells 2 times in your life, when you're a baby and then maybe in the adolescent years. You don't build new fat cells after that. So when the fat cells are gone, they are gone.
Gone.
If
But you can
add
gain
it,
you can gain new weight on top of.
Sure, fat's got to go. There's fat everywhere. So, you know, typically, actually, this was in the New England Journal of Medicine. It typically goes to the upper body most significantly when you have liposuction, say, of your thighs and abdomen.
Okay.
So it's got to go somewhere. It's got to go somewhere. It's a box, and if you stuff more stuff into it, it's got to.
The remaining fat cells just get bigger again, right? If you don't watch yourself.
The ones that are left, but it's not going to go like if I lipo your tummy, it's not going to go right to your tummy. If I lipo your butt, it's not going to go right to your butt.
I see.
It's going to go elsewhere. It'll go into your arms, your
Something to
neck,
think about.
whatever.
I didn't realize
Okay,
that.
gotcha. That's interesting too.
Pretty cool. All right, so people have questions for you on
Yes, sir.
these topics or any other topics. How do they get a hold of you?
HeartlandPS.com is my website. I'm right next to Living History Farms, and there's my phone number. Give us a call.
Yeah, 254-2265, 254-2265. Heartland PS Plastic Surgery.
You got it.
.com.
And stay tuned, because we're going to unveil new technology coming up next time you're here.
See you in 2 weeks.
I'm looking
right.
forward to that. That's
Yeah.
going to be neat.
Me too.
Can you do right here?
Heck yeah.
Okay. All right. We may have an experiment going on. Every guy in the audience went, what? It's